How's it going, guys? We have a pass level question, pediatrics 2CK, if you're studying for step 1. This is fair game, okay? So I'll give you some high points you need to know, not waste your time. Before we get started, subscribe to my channel. I really appreciate it. Give you a like, really appreciate it. If I have an Instagram, Mehlmanmedical, Mehlmanmedical, links down below for me, Telegram. Links to Telegram group or channel down below. Now start the clip. 6-year-old girl, she's got a 1-day history of a painful left hip. She recently recovered from an upper respiratory tract viral infection. Temperature 100 Fahrenheit. Physical exam shows no redness or swelling of the hip. She can bear weight. Leukocytes 10,000 per microliter, normal range 4 to 11,000. Which the following is most likely explanation for these findings. Now, as I said, it's a pass level question for peds. If you're studying for step 1, this is going to be a new diagnosis you probably haven't heard of before. Okay, so let's just hop to the answers here. Choice A: acute inflammation or acute inflammatory reaction in synovial lining. Correct answer. Diagnosis is transient synovitis, aka toxic synovitis, which is going to be a kid, usually school age, e.g. under the age of, or i.e. under the age of 10, which is going to be a viral infection followed by hip pain. That's literally all it is, okay? It'll be the hip on USMLE. So, and what you're going to do is you're going to look at the vignette and you're going to say, okay, are they telling me all these negatives for septic arthritis? Like there's no rubor, okay? There's no redness. There's no tumor, okay? There's no swelling here. She can bear weight. For septic arthritis, where you actually have a bacterial infection with pus in the actual joint space itself, they like throwing in details like leukocytosis, which the patient doesn't have, and that the patient can't bear weight. They like saying that, okay? So we have a bunch of negatives here where it doesn't sound too sinister. It's just you got hip pain following a viral infection. And those of you studying for peds, you're like, well, obviously, it's just toxic synovitis, which is transient synovitis, same thing. And it's just self-limiting. And they want acetaminophen or ibuprofen, okay? So obviously you don't give aspirin to kids, but that's what this diagnosis is, okay? So let's just quickly hop through the other answer choice here. Choice B, avascular necrosis, wrong fucking answer. So when we think about pediatrics, we want to think about leg calf perthes or perths, which is going to be idiopathic avascular necrosis of the femoral head. It's going to be a kid 5 to 8 who has hip pain, and they'll give you other like you'll be able to eliminate to get there, all right? You'll say, well, there's been no recent viral infection. It's not toxic synovitis. They're not mentioning anything about like history, of sickle cell, where if we have a known secondary etiology like sickle cell causing avascular necrosis of the femoral head, then it's not leg calf perthes. Leg calf perthes must be idiopathic. They'll give you negatives such as there's no hepatomegaly, okay, there's no reason to suspect Gaucher, okay, glucocerebrosidase deficiency, but with glucocerebroside, it's a rare cause of avascular necrosis of the femoral head. Just no glucocorticoid use, okay, obviously it's more rare for pediatrics, but occasionally, okay, when you do 2CK peds, occasionally you get autoimmune diseases like JRA or dermatomyositis. In peds, yes, you can. And, you have to think about, is the patient on chronic glucocorticoids causing avascular necrosis? Point is, wrong fucking answer. Choice C. Actually, real quick, I'll mention for avascular necrosis, they want you to know that the x-ray shows a contracted/compacted femoral head. It's just flat. That's all it is, okay? It's just you got to know that verbally. If someone were to ask you, what would you see on an x-ray of avascular necrosis? You're like, well, a necrotic femoral head. It's like, no fucking shit. But like, what would you actually see though? It's like, well, what I want you to say is you would see a contracted/compacted femoral head. They can mention that in a vignette sometimes, very buzzy. As I already said, wrong fucking answer. Choice B or choice C, bacterial infection, wrong fucking answer. So as I already harped on, we have plenty of relevant negatives here for septic arthritis, okay? So no rubor, no tumor, patient can bear weight, there's no leukocytosis, okay? So if we said that there's redness, there's swelling, patient can't bear weight, leukocytosis, we would say, well, that sounds more sinister, less likely to be toxic/transient synovitis, more likely to be septic arthritis. Wrong fucking answer. Choice D, disruption of capital femoral epiphyseal plate, wrong fucking answer. So obviously this refers to SCFE, slipped capital femoral epiphysis. Classically going to be, I'd say 4 out of 5 questions. You're going to have an 11 to 13-year-old pre-adolescent overweight boy with a painful limp. That's what you need to know. And the x-ray is going to show you what appears to be ice cream slipping off the cone. Very buzzy. You say, well, what does that mean? Well, It's a slipped capital femoral epiphysis. I don't know what to fucking tell you. Okay, it's the name of the condition. It looks like literally ice cream slipping off the cone. I've made other YouTube clips on this. So I said that's 4 out of 5 questions. Okay, it's just overweight, pre-adolescent, 11 to 13-year-old boy with a painful limb. The 1 out of 5, okay, which is going to be broken down, I'd say 1 out of 10 would be they're just going to say a boy who's 12 who they don't mention the weight. And the student gets confused because they're like, oh, I thought it had to be like an overweight boy. Well, I don't know what to tell you. 1 out of 10 questions, they're not going to mention the weight. And then the other 1 out of 10, so the combination now, that's the 1 out of 5. The other 1 out of 10, they'll tell you the BMI is 20. And the student's real fucking confused because they're like, oh, I thought the kid had to be overweight. It's like, well, they're showing you the x-ray right there of the ice cream slipping off the cone. So say 12-year-old boy, BMI 20, and here's a beautiful, very buzzy x-ray of ice cream slipping off the cone. The other answers are obviously wrong, and it's just skiffy as the answer. And why surgical pinning is how we treat that. Wrong fucking answer. Choice C, poorly developed acetabulum. Inflamed by viral antigen, nonsense answer choice, wrong fucking answer. Okay, so what you could know is that this former part of the question here, poorly developed acetabulum, is correct for congenital hip dysplasia. Okay, primary hip dysplasia, where you have a kid under the age of 1 who has the clicking clunking, the positive Ortolani-Barlow maneuvers. So after you get the clicking clunking, if ortho referral is listed, it's correct. Sounds wrong because students think like referral is always wrong. This is the exception. So if you have positive Ortolani-Barlow maneuvers, clicking clunking, you're going to do ortho referral if it's listed. If it's not listed, they want imaging. Under the age of 6 months, you're going to do ultrasound. Over the age of 6 months, they want x-ray, and they will be borderline with it. They will give you a kid who's 7 months, and the answer is x-ray, not ultrasound. Okay, so under 6 months, ultrasound, over 6 months, x-ray, and they want the treatment, which is going to be a Pavlik harness, P-A-V-L-I-K harness, which is also known as abduction harness. It's a frog leg appearing harness. They can write both on the USMLE. Okay, you get an easy vignette, and then the answer is just abduction harness. Poorly developed acetabulum is the answer for that question. In this case, wrong fucking answer. You know the deal. Need to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.